So after that, I stood up to get my phone and it was just blackout. I slumped.
So the baby came out like 20 minutes later and everybody was excited and they brought her to me and they had to take her to get her cleaned. And I got stitched up. Now, when I left that theater, that was when my woe started. Hi guys, welcome back to my channel. My name is Ezine. So today we're going to be talking about something I feel like is not talked about enough. Cesarean section delivery and vaginal delivery. This is my sister. I'll let her introduce herself first.
Hi, I'm Nina and I'm her sister.
Yeah. She has a beautiful daughter and I have a beautiful daughter as well. And she had her child through vaginal delivery and I had mine through C-section. So we're just going to be talking about our individual experiences and comparing them to see which is easier. I'm just going to ask you, give me a summary of your vaginal delivery experience, starting from your labor time to weeks after delivery.
Oh, okay. So my due date had come and gone and I was like, whoa, I was tired. I decided to walk around and that kind of helped the labor to start that night. It was 8 hours. To be honest, it was not as I was really scared. But it was not as you know, they say, oh, labor, this. Of course, the pain was there, but it was nothing that couldn't be endured, right? And it was even harder towards the end when the baby was almost coming out. The labor started in the night, like 12, and I had my baby by 8.
Yeah,
I had my baby by 8 a.m. So, and that 12 I said was mild labor. It was not one that I couldn't. In fact, I was still smiling, and they were telling me when labor starts, I'll not be smiling. But then labor had already started. It was just that I was few centimeters dilated, you know. So yeah, and then I had the baby. But prior to that, I had studied a lot. I was like a gynecologist at that time. I studied even how to push when I'm told to push. So it's not a situation of pushing wrongly, as I heard that happens sometimes.
Would you think your labor was easier because, number one, you envisage or you set your mind up for like more pain or like the worst possible kind of pain? So it then became a case of I prepared myself for this, so I was kind of ready when it came. That's why it wasn't so bad. I'll
say that's a psychology to you. But guys, anybody that is pregnant, avoid home videos, Nigerian films. So that was what gave me, that was what set the standard for me. You know, the way women are and please, I'm not trying to undermine the pain of labor, but then Nigerian films sold a narrative to me that made me even think I was incapable of doing that. But the pain is there, but it's something that you can do. So I think because I'd overrated the pain so much, so when I saw what it was like, I'm like, okay. So yeah, I think that's the psychology behind me.
Because when I heard you went on your feet, you know, you walked into the hospital yourself, I was used, I don't know why before then, I don't think I've had anybody so close to me have a child. So it was a case of I was expecting that way labor, everybody will hold you, and I heard you were driven to the hospital and you walked in by yourself. Like, how? And
I have a very low threshold for pain. Let me put it out there. Like, I don't know, I have a very low threshold.
But I think again, people have different experiences. Would you agree that some people may be in more pain than you? Yeah, so I think again you were blessed to have felt what you felt.
Yes, so some people I agree. I always say that my daughter was really kind to me. That's the phrase I like to push. And like, she was really kind to me. Yes, I'm not saying that is a standard for all labor. Some people are in labor for days.
Oh yeah.
Yeah, but yeah.
Okay, so I'll just tell my. Well, there was no labor story for me, so there's nothing to tell you.
But how do you decide? I know you made a statement about not having your child as a Scorpio. How do you decide?
Oh my god. You guys are going to call me vain, but let me just tell you guys what happened. So this is a Scorpio right here. So I decided no more Scorpios in the family. Okay, well, it wasn't that deep. Let me just explain something to you guys. So when I got pregnant, I was, you know, I battled with infertility for over 5 years. So immediately I went to the hospital. The doctor told me, you may need to go the C-section route. Just so there's no complications. Just make that an option in your mind. Then let us know what you want us to do. I spoke with my husband and he was like, he was okay with it. He felt like once I was even 38 weeks pregnant, I should stroll into the hospital and tell them, okay, get me my child. To him, it was that easy, get me my child, and then I'll stroll right out with my child. But I honestly wanted to go like the whole 9 yards. I was like, let me try for vaginal delivery first. And then I got to 40-week, you know, pregnancy, and the child wasn't even showing any signs of coming. And I opted for the CS. Now back to the vanity. I was still trying to contemplate because I heard I can wait a few more days and something would change. But that was Scorpio season creeping in. And I went to the hospital on 19th October. Scorpio season was supposed to begin when? 22nd of October. I'm like, nah, doctor. Okay, you're talking about doing a surgery on 21st. Let's do it. Let's do it. So that kind of helped to inform my decision. It wasn't the entire, of course, wasn't the entire reason. But all of this just, you know.
How vain?
Another vain. I wasn't ready for a Scorpio child because it wasn't going to work. But yeah, that's just how, you know, I got admitted the day before. Normal procedure, you're not allowed to eat anything from 6 p.m. the night before until after your surgery. I was rolled into the theater when it was time. It was more like a scheduling of time, not as, you know, dilation and all of those kind of things. So all of those parts, to be honest, were the easy parts for me. No pain, no labor, it was just easy and maybe just anxiety. So now let's talk about the labor, the delivery process for you. Okay. So at what point did you start, did they ask you to push and what was the experience?
So it's very funny. People find it funny to believe, but once I came to the hospital, and I'm going to add this part, when I came in, there was a woman in labor, so she was screaming her lungs out. Of course, I'm sure she has an even lower threshold for pain. I wanted to turn back and be like, okay, I can deal with the discomfort of pregnancy. But I'm like, let me just go in. And I went in and I slept off. I literally,
you slept off in labor?
Yes, I slept off till my mom's friend, who was the matron I was going to handle or receive the birth, came in. And they said, oh, I'm ready. So I did sleep off like on cruise. There was still pain, but it was enough for me to sleep off. Yeah, I slept off. And then when the woman came, I was like a teaching hospital, so there are nurses around. And that affected the way I don't want to say I don't see my private as so much private again, because there were a ton of people, you know, and they're like, oh, ready, spread your legs. I was kind of shy and all of that. And, you know, the labor started. So like I said, I'd read earlier that when you're about to push, it's not, you're pushing like you want to make a big poop, not the other way around.
Oh, really?
So yeah, my baby came out after 2 pushes. So the first push was, they waited for the contraction to come, and she goes push. So I pushed the first one and she was like, I'm doing good, like I'd read about it. Okay. And then the second, and I think she saw I needed the episiotomy at that point. After the first push, no, I think it was after the second push I got the episiotomy. Then the third push, the baby came out. Yes, yes, and it was numbed, and of course it was stitched. That was basically. So
just tell us about like the next few hours. When did you get on your feet? How did you feel? How was the stitching? Just like 2 hours until you were discharged. How did you feel?
Okay, so
and when were you discharged?
I was discharged the same day. My phone was not with me at the time, and at the episiotomy, of course, that side was numb, so I didn't feel any pain. It was more like relief. Oh, finally, thank God and everything. But then again, I was anemic, and this is what I like to say. So women who understand the benefits of having vitamins, folic acid, B complex, and all of that, even before you conceive, if you are planning. And if you're not planning to conceive, immediately you find out that you are pregnant, find out if you're even anemic. By anemic, I don't mean sickle cell. My blood count was really low. So after that, I stood up to get my phone, and it was just blackout. I slumped. Yeah, that was because of the anemia, right? So I believe that if my blood count was okay, it would have been nice. You know, after that, that was fine. That
even with that, you spoke with me like an hour after you gave birth. They gave our phone back and we spoke. Like, I cannot relate. I'm sorry. I cannot relate. So the whole of time we were just like holding your baby until you had to be discharged.
We had a bonding time. I had her on my chest and all of that.
Okay, so let me tell you my own process. So I go into the theater. Of course, the morning they come in and shave you because C-section. They did all of that.
No.
Okay, they come in and shave. I had shaved, but no. They come in and shave the very private part of your human body. And at that time, you're like, okay, that's fine. And then you go into the theater. So they used, what's it called? Epidural. There was another name they called that one.
Anesthetics?
It wasn't the... So I was going to be awake, obviously, but they just numbed that part.
Oh, okay.
So I don't know all the details. So I won't call it the wrong name. But it was like kind of anesthetic. Yeah, okay. It was anesthetic. The one that goes into your spine. I have to point out that I was very disappointed by the hospital. I grew up in, you know, a part of the country where doctors are more professional, doctors handle cases more delicately. So that's the part she had her child. I didn't get that in the part I was. And there was COVID-19, like it was a year of COVID-19 when I gave birth. So there was a sit at home, so that made it a difficult year for me to make choices as to where I wanted to have a child. Nobody tells you what they want to do, so they're just doing it. I know they only told me that bend a little and then they put that thing in there. And then you feel the prick, and after a while your body just begins to numb. And they keep touching and saying, can you feel it now, can you feel? Until I couldn't feel from my waist down or from my, below my bust or something down. And then they start to do the whole baby thing. And they're just gisting as if they are sweeping someone's, I don't know, it was a norm to them, it was something they were used to. But it wasn't so bad because I wasn't feeling anything. Obviously you feel the tug, because according to my doctor, the incision they made wasn't very big. So they'll have to like be tugging for the baby to come out. Yeah. Anyway, so I was feeling all of that. So they did that. That was the easy part, honestly. So the baby came out like 30 minutes later and everybody was excited, and they brought her to me and they had to take her to get her cleaned. And I got stitched up. Now, when I left that theater, that was when my woe started. So I wasn't allowed to move around, obviously. I was still lying straight. But I was freezing cold. I was shivering, my teeth were like...
Is that an effect of the...
I hear yes, it is. Nobody told me before, and I didn't read that part for whatever reason. They say it doesn't happen to everybody. But it happened to me. I was freezing cold, and I was, you know, vomiting a lot. They kept telling me, try not to throw up. You just had these stitches. It's not good for you. Oh, I don't know what you're talking about. I'll just throw up. So you're slanting on the side to throw up. So a nurse comes to hold a bowl for you. That was even before I came out. I was in the recovery room before I came to the ward. And then that goes on. And I'm like, okay, can I see my baby now? Okay, and then I go to the ward. A lot of that day was blurry because I was still under the influence of the, you know, meds I had taken. It was just slow, but what I know is I didn't get to see my child until much later because they felt like they didn't want me to move a lot, you know, with the child. So they took care of the child until it got to like a lot later in the evening. So that entire day, I just couldn't move and see my child until much later the next day when I was allowed to lift up my head and I could sit up just a little. And the recovery was just painful. You're in so much pain. They're injecting you every 6 hours because you're in pain. In fact, the next 6 days were torture. You can't bath yourself. I was immobile for 6 days. I managed on the second day to start moving around just a little, still in so much pain. And the stitches had to be cleaned regularly. There was just so much that happened that made it so uncomfortable. So it wasn't an experience I want to ever relive. I don't know. It's just terrible. So when I hear women say...
I'm just waiting for you to finish. Because, in fact, when I hear anybody tell me, how did you give birth? The normal way or the... I'm like, this is 2022. As a matter of fact, I don't want to quantify any, but I feel CS is even worse than vaginal delivery. Because yes, the episiotomy is there, but it can't be compared. At least after the vaginal, you are mobile enough to take care of the young one. But cesarean section keeps you bound. In pain. Yeah. Do you know?
I was going to ask you, how is the stitches with, you know, going to the toilet? Was it so much?
It was painful. Like, I have a low threshold for pain, and that part of the body is not where you get to have injuries all the time. You know. So it was weird, coupled with breastfeeding, and you should, during the breastfeeding, the beginning time, my baby, she was still learning to latch properly. So it was just a connection of pain, a burst of pain. It was painful, I wouldn't lie about that. But then again, I was mobile. I could do things by myself. Then using the restroom, I even had to research on how to nurse it because I saw different theories. So what I did in the long run was to just leave it dry. You know, that's how I was able to. It took a while. It actually took a while, but then it didn't make me immobile. I was able to do every other thing I was meant to do.
It's crazy. I didn't have, it was terrible. I was immobile, and when I started getting myself, my child had jaundice, so I had to sleep in the hospital again and move more than I should. So the stitches were also in trouble. It was just a lot. Well, the healing process took weeks. In fact, my doctors told me, they always tell people 6 weeks, but ideally it's 3 months. cesarean section stitches heal well in 3 months. And I was like, nobody ever told me that. So it was just a lot of things that happened around the time. I just get so offended when people like make light of C-section or joke about it.
Everybody should be offended by that.
It's
Every
something
woman.
You should, you know, make your woman feel bad about. I don't even know. I think the women who feel bad shouldn't just let themselves feel bad. I don't even understand. You can never make me feel bad about it.
Me, I don't even tolerate it. You can't come and tell me. And I didn't have a C-section, but I really don't tolerate it from people. I try to educate them and correct it, because in fact, some people even say you give birth like the Hebrew women. In their minds, they are saying the vaginal, and they feel like it's a measure of strength when you give birth vaginal. And please, that notion should stop. That is the basic essence of this video. So I mean, you've heard her story, like her talking about it. She doesn't really even express herself that much. This is the most I've even heard out of her experience. And I mean, to me, it's tougher. If you ask me, it is way tougher than vaginals.
It's a deep topic. To be honest, we're trying so hard to make this very short, because I feel like if we give detailed account of our experience, we'll probably have a 1-hour video. So guys, thank you so much for watching. Can you let us know in the comment section which was your experience? Have you had a baby before? Which route did you take? What was your experience? What do you think about C-section? What do you think about vaginal delivery? I promise I'm going to respond to all your comments. Let's make it interactive. Thank you all for watching, and thank you for coming, and until the next one, guys, bye.